Just a few decades ago, becoming pregnant after the age of 40 was considered relatively uncommon. Today, that's no longer the case. More and more women are choosing to become mothers at this stage of life, and this trend can be seen across many countries. The reasons vary. Some women spend years pursuing higher education or building a career. Others want to achieve financial stability before starting a family. Some are beginning a new chapter after remarriage. Others have spent years undergoing fertility treatment, and for many, it's simply a matter of meeting the right partner later in life than they expected. This trend is clearly reflected in official statistics. In the United States alone, more than 100,000 pregnancies are recorded each year among women over 40. In the United Kingdom, around 29,000 women in this age group give birth every year. Between 1997 and 2017, the number of births to women over 40 in the UK roughly doubled. If you're wondering whether it's really possible to get pregnant after 40, you're certainly not alone. Obstetricians, gynecologists, and fertility specialists discuss this question with patients every day. But knowing that many women are in the same situation is one thing. Understanding what it means for you personally is something else. So let's look at what modern medicine actually tells us about the chances of becoming pregnant after the age of 40. Can you get pregnant after 40? The short answer is yes. Pregnancy after the age of 40 is absolutely possible. However, the chances of becoming pregnant at this age are lower than they are in your 20s or 30s. That's because the reproductive system naturally changes with age, and we'll talk about those changes in just a moment. There are a few other important points to keep in mind. First, after 40 covers a wide age range. There's a significant difference between being 40, 41, or 45 years old. Second, while age is a very important factor, it's far from the only one. Two women of the same age can have very different chances of conceiving. Third, there are different paths to pregnancy. Some women conceive naturally, while others become pregnant with the help of assisted reproductive technologies, such as IVF. And the chances are not the same. These are just a few of the factors involved. There are many more. That's why the question, can you really get pregnant after 40, can't be answered with a single number or by age alone. To understand what these chances actually mean in real life, let's first look at what the research shows. Chances of conceiving naturally. According to large studies, women between the ages of 40 and 44 have about a 5% chance of becoming pregnant during a single menstrual cycle if they are having regular, unprotected intercourse. At first glance, 5% may sound very low, but it's important to understand what that number actually means. It does not mean there's only a 5% chance of getting pregnant overall, and it does not mean a 5% chance over the course of a year. It refers to just one menstrual cycle. Imagine a large group of women of roughly the same age who are all trying to conceive naturally. On average, about 5 out of every 100 women will become pregnant during a single cycle. In simple terms, that's roughly 1 month, although a menstrual cycle can be longer than a calendar month, so the two aren't exactly the same. The following month, those who didn't conceive try again. Then they try again the month after that. That's why it's important to look not only at the chance of pregnancy in a single cycle, but also over a longer period of time. Once you do that, the picture looks quite different. Research suggests that about 28% of women become pregnant within the first 6 months of regular attempts, while approximately 56% to 58% conceive within a year. Of course, that doesn't mean every woman has exactly those chances. These numbers represent the average outcomes observed in large groups of women. For example, the 5% per cycle estimate applies primarily to women trying to conceive their first pregnancy. Women who have been pregnant before tend to have slightly higher chances, but only by a few percentage points, not dramatically higher. There's another important point to keep in mind. When we say after 40, it can sound as though we're talking about a single age group. From a medical perspective, that's not really the case. Most studies combine women between the ages of 40 and 44. That's the group for which the commonly cited figure of about 5% per cycle is based. After the age of 45, the chances of conceiving naturally become even lower. However, there are far fewer high-quality studies focused specifically on women over 45. As a result, researchers usually avoid giving a precise number and instead conclude that the likelihood of natural conception is lower than it is for women aged 40 to 44. The chance is not zero, but it is lower than in the 40 to 44 age group. It's also important to remember that natural conception is not the only path to pregnancy. Many women become pregnant with the help of assisted reproductive technologies. What about IVF and other fertility treatments? So far, we've only talked about the chances of conceiving naturally, but modern reproductive medicine offers other options as well. The best known is in vitro fertilization, IVF. There are also other forms of assisted reproductive technology, such as intrauterine insemination. These treatments can be effective in certain situations, but they are not a universal solution for every woman. It's important to understand that none of these treatments eliminates the effect of age. In fact, the chances of pregnancy with assisted reproductive technologies also decline as the reproductive system ages. For women over the age of 40, the average chance of becoming pregnant after a single IVF treatment cycle is around 10% to 15%. However, the actual likelihood can vary considerably depending on factors such as a woman's age, the cause of infertility, the fertility clinic, and the treatment protocol used. The success rates of other methods, such as intrauterine insemination, are generally even lower. On average, the chance of pregnancy is only about 2% to 5% per treatment cycle. As a result, these methods are not appropriate for every patient. One point is especially important to keep in mind. Assisted reproductive technologies are not a way to overcome the effects of age, and they are not a guarantee of pregnancy. They are medical tools, each with its own indications, limitations, and expected success rates. There is no treatment that can guarantee pregnancy. Deciding whether a particular approach is appropriate is always an individual decision, made only after a medical evaluation and consultation with a physician who can assess the entire clinical picture, not just the woman's age. What changes with age? We've already established that the chances of becoming pregnant after 40 are lower. But why does this happen? The main reason is that the female reproductive system naturally changes with age. This is a normal biological process that begins long before menopause. Women are born with a finite number of eggs. Over time, that ovarian reserve gradually declines. But it's not just about the number of eggs. As the reproductive system ages, egg quality also changes. Errors during cell division become more common, chromosomal abnormalities occur more frequently, and the chances of successful fertilization and normal embryo development decrease. There's another important point to understand. When we talk about pregnancy after 40, it may sound as though every woman follows the same pattern. In reality, that's not the case. For some women, signs of declining reproductive function become noticeable by the age of 40. For others, ovarian function remains relatively stable for much longer. Some women are already approaching perimenopause at 40, while others won't reach menopause until many years later. In other words, a woman's chronological age doesn't always match the biological age of her reproductive system. Everything we've discussed so far describes the general pattern observed in large groups of women, but the rate at which these changes occur can vary substantially from one woman to another. As a result, two women of the same age may have very different reproductive potential, and therefore very different chances of becoming pregnant. It's also important to remember that age is far from the only factor that affects fertility. Many other factors play a role as well. Age isn't the only factor. What else affects your chances? Age does affect the chances of becoming pregnant, but it would be a mistake to think that age determines everything. It doesn't. Even two women in the same age group can have noticeably different chances of conceiving naturally. Why? Because age is only one of the many factors that influence fertility. Other important factors include ovarian reserve, or the number of eggs remaining, egg quality, which we've already discussed, whether ovulation occurs regularly, the condition of the uterus and fallopian tubes, endometriosis or other gynecological conditions, chronic medical conditions, body weight, metabolic health, lifestyle factors such as smoking, and even the reproductive health and age of the male partner. It also matters whether this is a first pregnancy or a subsequent one. All of these factors contribute to the overall picture. That's why being the same age does not necessarily mean having the same chance of becoming pregnant. You could also think of it this way. Age sets the overall direction of change, but it does not determine the outcome for every individual woman. In modern reproductive medicine, doctors do not predict a woman's chances based on age alone. To assess the likelihood of pregnancy, they always consider the full clinical picture, including the results of medical evaluation and all the factors that may influence fertility. Why it's impossible to predict one woman's chances. By this point, you may be wondering, If we have research and statistics, why can't we simply look at a woman's age and estimate her chances of becoming pregnant? The answer is straightforward. Because in real life, the chances of pregnancy are never determined by a single factor. All of the numbers we've discussed so far are averages based on large groups of women. But every individual woman has her own unique combination of factors that can influence fertility. Age is just one piece of that picture. When evaluating a patient's situation, a doctor considers all of them. Think of it as a mosaic made up of dozens of individual pieces. One woman may have endometriosis but still have a good ovarian reserve. Another may have no gynecological conditions at all, but a diminished ovarian reserve. One woman may have never smoked, while another has been smoking for many years. For one woman, it's her first attempt to conceive. For another, it may be her fifth pregnancy. And the list goes on. Each of these factors may seem relatively small on its own, but together they create a unique clinical picture that is different for every woman. That's why doctors don't evaluate individual factors in isolation. They evaluate how those factors interact. For the same reason, it's impossible to answer the question, what are my chances? Honestly and with complete accuracy, based only on a woman's age or a single test result. Statistics help us understand general patterns. But estimating the likelihood of pregnancy in your specific situation is only possible after a thorough medical evaluation and consultation with a specialist. What should you do if you're planning a pregnancy after 40? If your main takeaway from this video is, okay, so what should I do next? The most important thing is this. Don't try to estimate your chances based only on your age or numbers you found online. What's far more important is getting an objective picture of your own situation. Understanding what's happening with your reproductive system. Planning a pregnancy after 40 usually begins with a consultation and a comprehensive medical evaluation to assess the factors that actually influence the chances of conception and a healthy pregnancy. Depending on your individual situation, additional tests may be recommended. Your doctor may assess your ovarian reserve, check for gynecological conditions, evaluate your overall health, and look for other factors that could affect fertility or pregnancy. The scope of the evaluation is always individual, and your doctor will recommend the tests that are appropriate for you. Lifestyle also deserves careful attention. Smoking, being significantly underweight or overweight, poor nutrition, poorly controlled chronic medical conditions, and certain other health issues can all reduce the chances of pregnancy, regardless of age. Another important principle is not to delay seeking medical advice if you're planning to become pregnant now. Reproductive potential continues to decline with age, so having your situation evaluated sooner rather than later can help avoid losing valuable time. Finally, it's important to remember that there is no universal roadmap. For some women, a few recommendations on preparing for pregnancy may be enough. Others may need treatment or the support of a fertility specialist. Medical decisions should never be made according to a standard template. They should always be based on the individual clinical situation. So, can you get pregnant after 40? Yes, you can. Modern research and clinical experience clearly show that natural pregnancy after the age of 40 is still possible, although the chances are lower than they are at younger ages. We've also seen that age is far from the only factor. Every woman's reproductive potential is shaped by a combination of many different factors. It's important to remember something else as well. In this video, we focused only on the chances of becoming pregnant, but successful conception is just the first step. After that come equally important questions. How is pregnancy likely to progress? Which risks are actually associated with maternal age? What tests are recommended? How can you prepare for childbirth? And what does prenatal care look like after 40? Each of these topics deserves a separate discussion, and we'll cover them one by one in the videos ahead. The most important thing to remember is this. After 40, age does matter, but neither your age nor a single number in your test results can ever determine your future. What matters is not one individual factor, but the whole picture.